Thank you, Chair Schweikert, and to the ranking member. Look, like many of my colleagues, I support a bipartisan approach to many issues, including health care. I think the elephant in the room is we just had a partisan exercise where the result was taking health care away from 17 million Americans, not creating more access or affordability. And just recently, after the vote of the big ugly bill, the House Budget Committee chairman told Bloomberg that Republicans are planning even deeper cuts to Medicaid and also considering further spending reductions in Medicare. So on top of the $500 billion in Medicare cuts, that would be $1.5 trillion in total health care cuts. So help me understand how we're supposed to just come to the table now and agree without understanding the impacts to our constituents. Time and again, congressional Republicans have chosen to go after beneficiaries rather than to pursue the kinds of systemic reforms that are needed to increase transparency and accountability across the healthcare system. Mr. Fidler, can you outline how the big ugly bill would destabilize the Medicare system going forward, and where can beneficiaries expect future cuts to Medicare if they were made?
So the provisions of the bill itself, in terms of its effects on Medicare, are comparatively limited. The one important place where I think the bill will have significant effects on Medicare beneficiaries is it rolled back policy changes made during the Biden administration to make it easier for Medicare beneficiaries to get assistance paying their premiums and cost sharing. And those provisions will no longer go into effect, and so those enrollees will have more difficulty getting those benefits. In terms of other effects on Medicare, there is an effect on the sequester that would, in principle, require reductions in Medicare spending, and we'll see what happens.
Thank you. Now, Medicare Advantage is now the healthcare choice for nearly 34 million seniors and people with disabilities, accounting for about 55% of the entire Medicare population. In my district, that number is even higher at 56.2% of beneficiaries who've opted for a Medicare Advantage plan. A key driver of this growing enrollment is the broad availability of supplemental benefits. In fact, over 99% of Medicare Advantage plans offer at least one supplemental benefit, and most enrollees report that these benefits are a major factor in choosing their coverage. Dr. Jane and Mr. Fidler, two-part question. Can you speak to how the supplemental benefits available through Medicare Advantage, benefits not currently offered by traditional Medicare, help particularly low-income patients manage out-of-pocket cost? And Mr. Fidler, from a policy perspective, what steps can we take to enable traditional Medicare to offer similar supplemental benefits, particularly in the critical areas of hearing, dental, and vision, which we attempted to do when we had the majority?
Supplemental benefits can be the difference between someone accessing health care and not. They can be the difference between someone having a meal at dinner or being hungry. Supplemental benefits can be the difference between someone actually having a pair of glasses to see clearly or not. So I think these are incredibly impactful, and for lower income older adults, these are very high value benefits. The value of which often gets lost in discussions about the Medicare Advantage program and opportunities to improve it. I will say that there does need to be more transparency around utilization rates, because some of our competitors will make benefits available, but then put them far out of reach for the members. And so they have sales value at the point of care, but then many people at the point of sale, but at the point of actually needing a service, they aren't there. And so there's really an opportunity for, I think, CMS to take a more forceful posture in terms of regulating supplemental benefits.
So, I think there are significant gaps in the traditional Medicare benefit. You alluded to coverage of certain specific services. I would highlight the lack of a catastrophic limit on annual out-of-pocket spending. And I think a lot of the conversation we're having is that we're using the Medicare Advantage program to fill some of those gaps, but in a rather inefficient way and only for half of beneficiaries. So ultimately, the traditional Medicare benefit is under Congress's control, and it could fix that gaps. I think that would have benefits for traditional Medicare beneficiaries, but also, frankly, for those who rely on MA.